I'm Dr. Stephen Greer, General and Breast Surgeon at University Surgical Associates. I grew up around medicine. My father was a physician, so I always had an interest really from an early age. I looked at a lot of different possibilities throughout college, but actually started working in the operating room when I was 19 years old and loved every minute of it, and there was really no other choice from that point on. So I really think my training started with my first job in the operating room. Again, I was 19 years old. As a surgical assistant, I did that for 4 years, gained invaluable experience, did hundreds of cases. From there, went to undergrad at University of Tennessee, Knoxville, medical school at University of Tennessee in Memphis, and then I did my training here in Chattanooga for 6 years. It was really what I enjoyed the most. The wide breadth that general surgery contains, the ability to treat both very sick acute patients as well as people with very easy elective problems was a really nice variety, and ultimately I had to be in the operating room. I think my philosophy has a lot to do with communication. My patients and I, we need to have a very good conversation, make sure that they know exactly what we're talking about, what we're getting into, and ultimately we want to provide them with the best outcomes and the best care that we can. So the things that I find most interest in, the standard general surgery operations are great. I've really grown to enjoy treating breast cancers, and that's really a start to finish proposition as far as meeting the patient, having long-term follow-up, helping them through their surgery, potential chemotherapy is very rewarding. And then I also have a deep interest in some of the latest minimally invasive techniques to do big operations robotically in a way that's easier to recover and a much more cosmetic outcome. So I loved the area, and then I loved the practice. It's such a diverse group of physicians able to treat so much and to have such high quality partners that we can lean on, we can help each other out. I think really just made me feel that I could provide very good care to my patients. 90% of it is being with my family and my kids. They keep me plenty busy for any time I'm not at work. I do like to go fishing and be outdoors as much as possible as well, but family is definitely the top priority.